Are you a teenager? If not, I'm sure you know one. I'm Nurse Kodia. According to the CDC, 1 in 8 women with a history of PID experience difficulty in getting pregnant. Pelvic inflammatory disease is an infection of a woman's reproductive organs or upper reproductive organs. It is usually caused by sexually transmitted infections like gonorrhea or chlamydia. So, how does a person get PID? Number one, untreated sexually transmitted infections. Number two, having multiple sex partners. Number three, they've had a PID in the past. Number four, they're below the age of 25 and are sexually active. That's a common age group to get the disease. Next, the use of intrauterine device, and this is a form of birth control. It can be placed within the uterine wall or the uterus where a woman actually implants a child to prevent pregnancy. Now, a person that has this implant within the first 3 weeks is prone to getting an infection because it's just newly placed. So the risk for infection is limited within those 3 weeks. Now, this is just a sisterly advice from Nurse Kodia. If you're below the age of 25, why are you getting an implantable birth control to prevent pregnancy? You want to prevent pregnancy, I get it. However, you're preventing pregnancy at the cost of exposing yourself to infections, right? Because you want to be sexually active without protection. Now, the risk of that is that if you end up getting these infections and then damaging your fallopian tube, your ovaries, and eventually you cannot implant a child in your uterus, don't you think this risk is more risky than you preventing a pregnancy? So before you do something, I want you to ask yourself the question, why am I doing it? And what are the future risks that this process or procedure entails? So think about that. All right. Stay tuned for the next video.